One, two, three.
Hello, this is Ithaca DSA Presents. I'm your host today, Teresa Alt. I'm here with Dr. Susan Soboroff, a family doctor and also a healthcare activist. A few weeks ago, we presented Dan Lamb, who used to be an aide to Congressman Hinchey back when this town was in a different and no longer existing congressional district. He was talking about the ACA, the Affordable Care Act, also known as Obamacare, and the struggle going on in Washington. Of course, at that time, Trump had promised to repeal it. Then that turned out not to be quite so simple. It became repeal and replace. Yesterday, House Speaker Ryan delayed the vote on the replacement legislation, and I think it's reasonable to say we don't quite know what's going on in Washington on this issue at the moment. So, what have you got to say about that, or what our reaction ought to be, our response?
Yeah. Well, the fight right now is among Republicans. I'm rather hoping that they don't have enough numbers to actually pass the repeal, because the replacement is what we call meaner and leaner. But the controversy has been between those folks who want to pass the HCA as it is, and even more right-wing Republicans who want an even meaner and leaner bill. But in fact, what the debate should be is between the Affordable Care Act and Medicare for All. And that's what I'm hoping we'll talk about today, because I've been pretty active in the advocating for single payer for a long time, and right now there is a bill for New York State. It's an expanded and improved Medicare for All type bill that would cover all New Yorkers. It passed in the Assembly, in the New York State Assembly, twice now. It's been reintroduced this year, and it's very encouraging that there are actually 27 co-sponsors in the Senate, including members of the IDC. So,
IDC being the so-called Indy Caucus, the Independent Caucus, those Democrats in name who caucus with the Republicans, but then again aren't always, I don't understand them, to be honest.
Right. Well, I can't say as I do either, but in fact, all the furor over the repeal of the Affordable Care Act has really activated and energized a lot of people who don't want to see, don't want to lose their health care, because the Affordable Care Act did provide, more coverage for 20 million people nationally. And had some distinct advantages. I think members of the IDC have been feeling the pressure of people who don't want to lose their health care. But New York State Health Act will guarantee health coverage for everyone, and makes a lot of sense.
For everyone in New York State.
Everyone in New York State, that's right.
Well, if the New York Health Act covers everyone in New York State, isn't that going to be incredibly expensive?
Yes, healthcare is expensive, but in fact it represents a huge savings over our present system. The Affordable Care Act left the private insurance industry in place with all its complexity and inefficiency and profit-driven bottom line. And in fact, the administrative costs of our present system can be up to 30% of the healthcare dollar. So 30 cents out of every healthcare dollar goes towards marketing, profits, hiring people to deny patients coverage, and the incredible administrative costs of billing by providers, hospitals, doctors. So if you take our Medicare system, which is a great model for a publicly funded and administered, privately delivered system, their administrative cost is something like 3%. So the difference, if you take the difference between administrative costs of up to 30% and 3%, those cost savings, along with other ways to save money, like negotiating for drug prices, those savings are enough to cover everybody. So, and in fact, a very good economic analysis was done in order to introduce the bill into the Assembly a couple of years ago. Gerald Friedman, an economist in Maryland, and he crunched the numbers and concluded that 98% of the families in New York State would actually save healthcare cost money using the New York Health Act bill and using a Medicare type system.
Would save money. Is that to say that while their taxes would go up, they wouldn't have to be paying premiums, I assume, and they wouldn't be paying premiums, they wouldn't be paying co-pays, deductibles, that they now don't exactly have a choice about.
Right. Well, their total cost, that's true.
The total cost of healthcare.
For healthcare would be significantly less. Because as we've seen, even with the Affordable Care Act, people's premium rates have gone up, their deductibles have gone up, the benefits have gotten worse, the provider networks have narrowed, and even people with insurance are underinsured. They're paying so many out-of-pocket costs towards deductibles and co-pays that they can't afford to see their provider. In fact, a recent study showed that a third of the households with insurance in the country can't afford to see their provider. So that doesn't make a lot of sense.
Yeah, I remember a young man telling me about that problem. He had, he'd signed up when the act was new, and that seemed very simple, and he thought the choice was simple. And then when he actually had a back problem and needed some sort of serious treatment, he found that it was going to be incredibly expensive to actually.
Exactly.
Yeah. And I never quite heard the end of that story, but.
Well, what it would mean is that, the way the bill is funded is that all of the federal money that's now coming to the state from Medicaid, Medicare, CHIP, that would all be funneled into one public trust fund. And then New York State and employees and employers in New York State would have to make up the difference. And that would happen by way of a payroll tax assessment. But those assessments would turn out to be significantly less than what they are now. But it would look a lot like, what our wages are assessed for Social Security and Medicare. And that would mean that there would be no premiums, no deductibles, no copays.
Well,
And everybody would be covered, even though it would, the funding would come through payroll taxes. Your health care wouldn't be connected to your employment. So you could move jobs much more easily.
and you'd stay on the same system,
Exactly.
which
Exactly.
would be a big savings, or when you lose your job.
Right. And the payroll assessment is a progressive tax, which means that you pay according to your ability to pay. In fact, the first $25,000 of wages is not taxed at all.
Oh, well, that's very different from Social Security, actually,
is.
where Social Security taxes the first penny,
Exactly. And it's very different from
and then doesn't tax the very high incomes.
nearly as much. That's right.
Well, it just stops after a certain point.
Right, there's a cap on it.
So this would be not starting at the bottom
Exactly.
and not without a cap at the top.
And exactly
okay.
No, there is
No,
there is a cap of
there is a
14%. There is, but and it would only be the very highest income earners who end up paying as much for their health care insurance as they do now. Everybody else would be paying much less. Right, and non-earned income will also be taxed. So dividends, capital gains, things like that
I see.
will be taxed at the same rate. And that's also much more fair
Right.
as far as
Yeah.
raising
Yeah,
revenue.
I mean, why shouldn't the stuff that you get without lifting a finger be taxed
Exactly.
if you're going to be taxed for your work?
Exactly.
Dr. Susan Soberup, where can people find out, look things up about this?
If people want more information.
Yeah, more information.
Which I hope they do.
Getting involved, for that matter.
Well, the website for the campaign is nyhcampaign.org. There's a lot of good information there. There's, in fact, the whole text of the bill is on the website.
Oh, wow.
As well. More locally, I belong to an organization called Finger Lakes for New York Health, and we have a new Google group just starting up. It's FL4 NYH, and there's going to be a lot of information posted there as well.
So various ways to get all the details, if anybody can stand to face all the details.
Well, it's complicated. Health insurance is complicated,
Well,
but a Medicare for all type system is so much simpler than the system that we have now. And as I've mentioned,
Right.
will save us money. Will save most of us quite a bit of money. And the uninsured, there's no question, but the people who don't have insurance have poorer health outcomes. And so if we have a way to cover everyone with all necessary medical benefits, and that includes outpatient, inpatient, drugs, mental health, dental, vision, it covers more things than Medicare, traditional Medicare does, in fact.
Oh.
So that people who are on Medicare will want to be part of this system.
So they would also people on Medicare would also transition to this system if they live in New York State.
That's correct. That's correct.
Okay.
And they would want to, because it actually covers more than traditional Medicare, which is why we call it expanded and improved.
Okay, improved. Yeah, improved Medicare for all is
Exactly.
usually
Exactly.
That starts to sound very good. I have never in my life had dental insurance.
Well, you would under New York
Yeah.
Health. And that makes it, so that's going to make it attractive for everyone. It's really mainly the very high income brackets that, they'll still have their platinum plan because the coverage will be very broad, but they'll be paying as much as they do now. And everybody else will be paying a lot less, and covered by a plan that's publicly accountable. It won't be, doctors will be freed up from the private insurers telling us how to practice medicine, telling us and the patient which tests they can have. It will completely eliminate the private insurers, except for procedures or tests that are not covered by the plan, things like cosmetic surgery. But otherwise, the private insurers will be out of the picture. That's really a lot of the reason that single-payer Medicare for all hasn't been enthusiastically taken up by the federal government. The healthcare insurance lobby is incredibly powerful and are making huge amounts of money on people's illness.
Which is coming out of our insurance premiums.
That's right, exactly.
So we're paying the companies, you might say, to lobby against us.
And deny us coverage.
Well, I was one of a group of citizens who actually went to argue for, I think at that time, federal Medicare for all, which has also been a proposal.
Yes, that's right.
We went to the office of our Congressman, Tom Reed, downtown in Ithaca. Usually we would just go and have to slide, tape a message to the door or slide it under the door or something, because it's usually not staffed. But one day we did meet a staffer and went in and talked about it. And the staffer claimed that this would result in rationing. There would be long waits. He had some relative in Canada who had to wait for a long time for some procedure. So is there a way to avoid that?
Avoid
waits. The supposed... Now I have to say that I'm also used to waiting in the United States. I mean,
exactly.
When I found out I had cataracts, I waited a couple of years till I reached Medicare.
So that you would be covered.
And so as to be covered for it.
Yes.
And also, long ago, there was what was it? I went for a pap smear that turned out to be not quite right, but I didn't have insurance. And so again, I just waited a couple of years till I finally landed a job that provided insurance before I had it checked out, which
Precisely.
Turned out to be, well, I'm still here.
Well, yes, in this country, we ration healthcare based on ability to pay. But in fact, the lines in Canada aren't what the folks in Tom Reed's office said they are. Yes, they do have a problem with wait times, but that's only for elective procedures, like having a knee replaced or, having something removed from your skin or something like that. In fact, for anything that's urgent or certainly an emergency, those medical services happen just when they need to happen in Canada. And in fact, the Canadians are very, very satisfied with their system. It's been in place for decades now. And you don't see throngs of either Canadians or Canadian providers coming across the border to be here and partake of our healthcare system, because they know how good they have it. There are no bills. They can go to their doctor or emergency room. There aren't any bills. And it just all happens automatically for people, and they're very satisfied with it. The people who argue, we were at State Senator O'Mara's office recently, and he just looked at us and said, this is all too good to be true. And in my experience, things that seem too good to be true are too good to be true. But in fact, I think you can only think that way or use that argument because we've grown up with a system that is so unjust and lopsided, and when in fact the rest of the world provides healthcare. At least in the wealthy countries, they provide healthcare for everybody,
Mm-hmm.
and their medical outcomes are better. People are healthier in other countries besides the U.S. And it just gets to be, it would be a positive cycle, in fact, if we kept people healthier by allowing them to see their doctors when they need to, or when they want to. It would cost us less in the future because people are healthier and they wouldn't have as many needs as they do now. Now, with our system, when people wait and wait and wait until they have an emergency, and then they go to the emergency room and they have to be hospitalized, and it gets to be so complicated and so costly, and sometimes people don't survive. In fact, recently, almost 29,000 people in this country, nationally, died because they didn't have health care insurance. And that's just, that's criminal as far as I'm concerned.
And that's, in fact, it's an interesting number that you cite, this 29,000, because it kind of, I remember back like 15 or 20 years ago, long before the Affordable Care Act, when that number was more like 45,000.
That's right.
And it was more like 45 million uninsured. So this 1,000 to million ratio seems to have held.
Yeah, that's true. That's true. The number has gone down. But it's still close to 30,000.
Yeah. But I mean, it still relates to the number of uninsured under the system.
It has only to do
it's
with
proportional.
People being able to afford healthcare coverage. That's correct. That's right. In fact, there was a recent study of maternal mortality. Our maternal mortality is 3 times that of Canada. And between 2000 and 2000...
Maternal mortality, meaning mothers who die giving birth.
Exactly. Thank you for clarifying that. It went up in an unprecedented way between 2000 and 2014. And that was the same time that some states were opting not to take expanded Medicaid.
Oh.
So it had only to do... And in Texas, for example, it doubled. And Texas, of course, was one of those states. And so that has only to do, I mean, mothers dying in childbirth, at least in those years, has only to do with the fact that they could not afford health care coverage. So we need to do better.
Right. Well, I mean, I know the infant mortality also, we're sort of on the edge of the third world.
Exactly. I think we're kind of in the middle of the third world. That's right. That's right. Not very good as a score.
But actually getting back to, I mean, we wouldn't be able to, we would only, by adopting New York Health in New York State, we would only be able to improve things in New York State. Now, correct. New York State is good and big. It is bigger than a lot of nations.
It is, and it's wealthy. So this is a good place to start. The way the Canadian system evolved was it started in one province and went from one province to the next.
But it started in a small province. That would be sort of like starting in Montana.
That's true.
Saskatchewan.
Yeah, that's true.
Whereas here we're talking about starting in a very big state and
correct.
A very urban state.
Correct.
But I think you said something about how the campaign was advanced. The prospects look better now than in earlier years.
They certainly do. And the other encouraging thing is that there are people in several other states who are very close. In fact, in California, a bill has been introduced. It looks a lot like New York.
I see.
But California
I've heard, yeah.
has been very active. Oregon, Washington, New Mexico, Minnesota. There are a lot of states that are, well, several states that are actively working on it. That's right.
So how are people working on it here in New York?
Well, one way is to try to educate as many people as we can so that people understand how important this bill is and can then pressure their senators in particular, but legislators in general, and continue to educate their communities about how important this is. It's really a nonpartisan issue. Anybody, everybody can be sick or injured at any time, and want to have children and get their teeth fixed and make sure that they're on the right track as far as preventive health as well. So we would all benefit from the New York Health Act.
Well, and I've heard that there are people going to Albany to lobby for it.
Oh, glad you said something about it. Yes, April 4th is Lobby Day for the New York Health Act. So everybody is welcome to come and lobby there or other state legislators. Yes.
So again, to get in touch with the people who are going to Albany, I guess it's that same website, isn't it?
It would be the same website. It has information and a link where you can register to go to Albany. Yes, NYH campaign.
NYHcampaign.org.
Yes,
said.
That's right.
And you also gave the local contact.
Yes, FL4 numerical 4 NYH at googlegroups.com.
Okay, so in fact, if people want to work on it, they can join that, but they can also, of course, always just get involved locally.
Absolutely. Either by just being informed by the listserv, or they're welcome. People are also welcome to come to our meetings. So
this has been Ithaca DSA Presents. We've been talking about the New York Health Campaign, the campaign for the bill New York Health. I'm Teresa Alt. I have been talking with Dr. Susan Soboroff. Thanks for watching.
1, 2, 1, 2, 3.